Anyone who's faced a long recovery from a major medical crisis can tell you quite simply it is a tough road to travel. The after effects of a severe bone break, a head injury, even a heart attack can last weeks and even longer after you leave the hospital. That's why rehabilitation is so important to a full and complete recovery. One place designed with just that in mind is OhioHealth Rehabilitation Hospital. We have Dr. Jonathan Pedrick, the medical director, there with us today. So thanks for being here.
Hi, thank you. Glad to be here.
Now, your expertise is in physical medicine and rehabilitation. So tell us a little bit about what that encompasses.
All right, our field is mostly dealing with recovery from strokes, spinal cord injuries, and brain injuries. And they can be very serious and very life-changing, but we understand what the families need to know and education along the lines, and we provide services to try to help in terms of their recovery and get them set so that they can live the rest of their life as well as possible, and also potentially make full recoveries too.
That's the hope, right? I mean, that's the reason that you put through these rehabilitation plans. Why exactly are they so important to your full recovery?
Well, they're important because we know the medicines very well that help in terms of stroke recovery, in terms of brain injury recovery, in which we can help maximize your potential and also provide the education along the way that you need to know, and the places where you can get your best therapies and also the best patient experience as well.
Because you certainly, at one point, you're going to have to go home and kind of deal with this yourself. So you guys give them the education they need to be able to really heal.
Mm-hmm.
Okay. All right, Dr. Pedrick, what types of medical rehab programs do you offer? You mentioned a few of the things you treat, but what kind of rehab do you offer there?
All right, well, we offer something called inpatient rehab. It's much different from like a nursing facility where somebody might go in terms of a longer term, lower level rehab. This is very intense. It is all day rehab. It is very skilled. Our therapists are wonderful. Our nurses are wonderful, and it is a hospital. So it's not just some place where you go to just do the rehab, but we address medical issues. We look at blood pressure. We look at vitals, and people can be very sick, but still be there and do the intense rehab. And we have found that the more intense rehab can get people home quicker and can get people home better. And really the family education and the practice that you get there is pretty much about the highest level you can get.
Those are all great things. Getting home faster, better. I mean, these are what we all want, right?
Yes.
Okay. You have a particular interest in head injury rehabilitation, and one of the most common is a concussion. And, you know, we hear a lot about this in many different ways. So what do you guys focus on when somebody comes in with a concussion?
Okay, well, the main thing is education first. Majority of people have not experienced a concussion or a head injury before. And it's much different than other types of injuries. The analogy I like to use is if somebody breaks a leg, you put a cast on it, and everybody signs it, everyone's happy, and you don't ask the person to go walk around on it. You don't ask, you don't ask them what's wrong, why are you not back at work? But head injuries you can't see. People still look the same, they talk the same, they walk the same. So it's hard for people to really understand what they're going through, but it can be very serious. People have trouble concentrating, people have trouble with headaches, they have trouble with anxiety, they have trouble trying to get back to work. And it's very comforting to be able to have a physician understand that, explain it, and also help in terms of getting back to work, help in terms of trying to get back to society, help with your headaches. And so it's just something you can't see, so it's nice to have that education. And again, I can't just put a cast around somebody's head and expect them to say, okay, they've had a concussion, they've had a head injury, so let's let them go with a cast on their head.
And they have to heal for an appropriate amount of time, I'd imagine, which is why they need to go to a rehabilitation hospital. What happens if they don't allow themselves that appropriate time?
Well, what happens is it becomes very frustrating. So people try to push themselves, and they have trouble with headaches, they have trouble with completing their job, they have trouble driving, a lot of basic things that really you need to allow time for the brain to heal. You need what's called cognitive rest. So that's basically where you're not doing a whole lot. You're mostly laying around the house. Basically, just like any bone needs time to heal, the brain really needs time to heal. And the brain is remarkable. So even in the most severe traumatic brain injuries, young people especially, they get better. People can be in a coma for a month, they can be in a coma for 2 months, and remarkably, with the right rehabilitation process, they can make incredible recoveries to the point that you wouldn't even know that they had a severe brain injury before.
That's incredible, and that's obviously what I'm sure everybody is hoping for, is the end result there. So to come into the OhioHealth Rehabilitation Hospital, do people need a referral, or how can they see you?
So the way they can see us, we can be referred from an outpatient, but a lot of times you're in the hospital already, and we can come and see you. Most of my patients I like to meet actually when they're in the ICU. I like to meet patients and families early and be able to talk to them and educate them mainly and say, hey, listen, we've done this 100 times, and I want to help you guys and help you understand what the rehabilitation process is like, and I like to ease the anxiety of families. It is incredibly stressful and traumatic to have a family member go from healthy, involved in a bad car accident, and you get that phone call in the middle of the night that you need to get down to the hospital and we don't know if they're going to make it. You don't sleep, you're stressed, you're in a hospital, you don't know what's going on, you don't understand the words that are being said, the surgeons coming by giving you updates. It's a horribly stressful experience. So we like to get involved and say, listen, we understand what you're going through. We understand this is a very unpleasant experience, but we want to help you and we want to guide you along. We help with insurance, we explain in normal people terms everything that's going on, and then we try to ease the transition, just take the anxiety and take the pressure off the families.
Okay, that all sounds amazing. Of course, you want the best experience. It sounds like Ohio Rehab Hospital is definitely offering that. So thank you for being with us. Contact information is on the screen.
Okay, thank you.